So if you are a PT or if you're taking SOAP notes, how do you add pelvic floor muscle exercises to your treatment plan? All right, so the subjective, you're going to note your patient's symptoms. Your objective is going to be signs of pelvic and hip weakness, poor general lumbopelvic coordination, motor planning, motor control, the tendency to strain or valsalva with transfers or functional lifting, and the voiding log would be in part of that. The assessment would be noting any high-risk intrinsic or extrinsic factors that we talked about, any comorbidities, and any reason you believe the patient will benefit from the pelvic floor muscle exercise. And the plan would be to include these pelvic floor muscle exercises to improve lumbopelvic control, reduce fall risk associated with incontinence, improve stability about the pelvis, and with the functional transfers. The ICD-10 codes that are used here, you can see general weakness, with the M62.81, you can use that for pelvic organ prolapse. Stress urinary incontinence, N39.3. Urge urinary incontinence, N39.41. Mixed urinary incontinence, N39.46. And pelvic pain, R10.2. Right. So when you're writing your goals here, P for patient will be independent in pelvic floor muscle activation prior to cough, sneeze, lifting, etc. My goal is for my patient will be able to independently verbalize at least 3 urge management strategies to facilitate continence and reduce risk of falls with rushing to the bathroom. Patient reports no more than 3 soiled pads per week to improve functional mobility that is currently limited by incontinence. And the patient will demonstrate independent ability to co-contract their TA and pelvic floor to improve lumbopelvic stability and continence with functional mobility and transfers. Our pelvic floor statistics and predictions. Right? Females with urinary incontinence, only 25% of symptomatic women seek care, and 12% receive subspecialty care. If the United States population increases 24% by 2030, as projected by the United States Census Bureau, we predict the demand for care for pelvic floor disorders will increase by 35% between 2010 and 2030. The total number of women who undergo surgery for pelvic organ prolapse from 2010 to 2050 is expected to increase by 48.2% over these 4 decades. So there's a need for improvement and therapists. We need to catch these things earlier and be part of the solution.